Chair Crop, members of the committee, I'm Marion County Commissioner Danielle Bethell, and I feel like I should know each of you personally for the number of times I've been in front of this committee on this particular subject and civil commitment in general. I want to thank you all for your time during a short session to even consider this bill. I know it's difficult to have a conversation around providing force of any kind to anybody that's in crisis. But this particular bill is one more tool in the toolbox that I need as the local mental health authority to be able to serve my neighbors to the best of my ability. We have a very robust team in Marion County with lots of invested resources to do non-police forward type of behavioral health treatment and transportation if the individual is in compliance with that transportation. What we don't have is when they don't want to be transported, a tool to be able to navigate them to a healthcare facility. I'm tired of sending people to a jail. If we keep sending law enforcement on a 911 reaction to a crisis situation, we're going to continue to see that repetitive cycle. I want the system to work for vulnerable populations. This bill provides a gap filler in the process of law right now that prohibits us from doing the best we can to take care of vulnerable individuals. The sheriff will talk in a little bit more about the details of law enforcement and their role. I've met with several members of this committee one-on-one to promise relationships with those that would be opposed to this type of law. And we have language that we've provided to Representative Anderson's office and his staff to introduce an amendment to try to get further down the road of what I would say a compatible entrance into the change of the law. The language, if you'd like me to read it, I can read it into the record. Would specifically be a proposed amendment to Section 1B. The wording is the liability protection in this act, protections in this act do not apply in cases of gross negligence or willful misconduct. And I can tell you, as somebody who has lived experience, as I've shared here before, the last thing I want is for somebody who's experiencing a crisis and already deeply scared of a variety of things that they may be unsure of, is to face additional fears and challenges that the presence of law enforcement would create. And I never want anybody to do that in a space outside of direction of the qualified mental health system that we have here in Oregon. We need to have this bill in place so we can continue to grow our supportive system of care in Oregon for those navigating mental health crisis. I especially want to say thank you to Representative Anderson. You spent a lot of time with me and my team navigating this. It means a lot to me that you're willing to stand up for the county, my county, all counties, and this population. I know it's not a welcomed environment because it's a difficult system to navigate, and it's not perfect in Oregon. But I think if we continue to take one bite at the apple at a time, we can get there together to create a better system for everybody. Thank you for your time today.